So keep that a secret, everybody. So, Dr. Vanessa Bradford Kerry. Dr. Kerry is the Associate Director of Partnerships and Global Initiatives at the Center for Global Health at Massachusetts General Hospital, where she focuses on how to best develop global health education, research, and capacity building activities to strengthen public sector health systems in resource-poor settings. She also spearheads the program in Global Public Policy and Social Change in the Department of Global Health and Social Medicine at Harvard Medical School, to help advocate for healthcare as a tool to address economic, social, and cultural disparities that define poor health domestically and internationally. And one of the things I'm really excited about with Dr. Kerry is this idea that she'll share with you of a Global Health Service Corps. And she's the co-founder, and along with colleagues, we've talked about it, just the idea that sometimes it's hard to get involved in service, and we want more opportunities for young people to serve. And as soon as I heard about this idea, I was really inspired, and I knew we needed to have Dr. Kerry here to share it with all of you. So without further ado, please join me in welcoming Dr. Vanessa Bradford Kerry.
Good morning. It is an honor to join all of you today. I know you've had an incredible weekend full of events, seminars, speakers, and I'm sure bounding ideas. You all come from what I understand, having looked through the roster of people who are here, you all come from incredible backgrounds and I know projects and efforts, and I hope this weekend's really been an opportunity to learn from one another, from the speakers, and that you've all had a good time and are going to go home from what I'm sure has been an eventful weekend. And I want to congratulate the foundation winners. Your work is really inspiring and a great reminder to all of us of what is possible. I'm hoping to talk about a couple of things today that are near and dear to my heart. It's actually two interrelated ideas. One is accompaniment and the other idea is service. And accompaniment really is a kind of service. I have the privilege of calling among my mentors Dr. Paul Farmer. And Paul has taught me many, many things. He has taught me more mundane things like how to turn any phrase into an acronym, so opportunities for the poor becomes O for the P, or too numerous to count, TNTC, or if I were to say, hey, I'm feeling really tired, exhausted, and grumpy, you'd be like, oh, so you're a little TEG? But acronyms aside, he has taught me an incredibly critical lesson for engaging in global health and social justice work, and one that I believe is essential to all of our missions, and it's called accompaniment. What exactly is accompaniment? And the Phillips Brooks House sounds like they've got this idea and they're working it. But to accompany someone is to go somewhere with that individual and to be present on their journey. It can apply to a project or a mission as much as it can apply to people. An accompaniment is a shared experience of sort of an unknown, and often unknown outcomes. It's a general idea of where, you have a general idea of where one is headed, but we cannot always predict what will come or how long it'll take. It's the idea that I will go with you and I will support you on your journey. I will keep you company and I will share your fate for a while. And when we talk about a while, we don't mean a little while. Really, it's actually, as Paul will be the first to tell you, accompaniment is much more often about sticking with a task until it's deemed done by the person or the people that you're accompanying, not so much by the accompagnateur. And it's one of the most important lessons I think we can have for any stage of life. We live in a world that is dominated by rapid everything, rapid communications, rapid technology, rapid production, rapid travel. How many of you expect a quick response to an email you've sent? How many of you get impatient when your coffee takes an extra minute to make? I will hold my hand up on that one. How often are you checking your phones for email or text? And I'm curious how many are actually checking now. But the rapid pace of our lives and the increasing pressures that come has changed us into a generation of multitaskers. This is not necessarily a bad thing. But we tend to multitask our communications. We tend to multitask our meals with our work, the football game with our homework. And the problem is that we can multitask our interests. our missions. And we'll divide ourselves across a number of activities or projects. And our reasons are diverse. We may do it because we want to augment our CV because we know we're applying to graduate school. Or we may do it because we can't choose between important ideas, things that really we feel strongly about. Or we may do it because someone has cajoled us into participating into something. We can be distracted. But further, our patience has diminished with this pace in technology. And we've come to expect results really quickly. I know that, at least in medicine, I always anticipate that I'm going to understand the results of something very quickly. And that we think that we will understand if something will work or not work within seconds rather than waiting patiently over time. But for the work that many of us are engaged in, lasting change, effective change needs nurturing, focus, persistent investment, and time to unfold. Change from our actions may occur quickly, but more often than not, it's going to unfurl slowly over months and years. And despite every pundit's argument to the contrary, change may not be seen over a single political cycle, but over many. And the true product of your work, all of our work, will be seen next year and the years to follow. My other mentor, Dr. David Bangsberg, puts it differently. David always reminds me that life is a marathon and not a sprint. He actually gave me a rock that he wants to carry in my pocket to slow me down that has that imprinted on it. But it is the same idea of dedication over time. And he advises me to apply this philosophy to even my smallest tasks as much as my big goals. And I'm a distinctly impatient person, so the reminder is always helpful. But this idea of accompaniment and committing to a marathon applies to the process of lasting change, and ultimately change, the kind of change that we all want to see, will occur with our unrelenting focus, our patience, and this critical idea of accompaniment. It will require our time, our dedication, our nurturing, as much as it's going to need the flow of time to really take hold. We must journey with our work, our programs, our partners, and share our path steadfast to their mission, our mission. And in essence, we really just must accompany it. And this idea of accompaniment is critical to the second idea of service, because accompaniment is service. And it's a means of service that I'm trying to employ now with the Global Health Service Core, which we actually now call the Global Health Service Partnership, in order to really reflect that sense of collaboration. A few disclosures. This is actually my first public address about the Global Health Service Partnership. And second, it doesn't actually exist yet. Today, it remains a movement, not yet a deploying service entity, and I wish I could say that it was fully incorporated, and if all continues as we're headed, we will be able to say it very, very soon. But for now, we are a persistent, resilient good idea with enormous potential and incorporation to come. I'm going to explain. The Global Health Service Partnership was developed in recognition of a series of separate problems that could have a common solution. As many of you know, the last decade has been characterized by an emergency response to health epidemics around the world. So for example, HIV/AIDS. It's been killing millions worldwide, and countries and individuals have banded together to help provide very needed treatment to individuals and those in need. But the work is far from done. Millions still need treatment, and millions still go untreated. But despite that, there's a growing recognition now that vertical disease-focused programs will be limited in their success and scale without broader engagement in health system strengthening activities. We need to build sustainable change where countries are able to provide treatment themselves, instead of importing doctors, nurses, pharmacists to plug the dam. Health systems in developing countries suffer from major shortages of health personnel, which limits their ability to deliver care not only critically or the most basic health care, but to respond to these growing and emerging epidemics. We're actually seeing an epidemiological shift right now where non-communicable diseases are on the rise. So while HIV/AIDS is still devastating sub-Saharan Africa, cardiovascular disease is now the second leading cause of death in the country, and cancer in the continent, and cancer is actually about to be the third leading cause of mortality on the continent. The WHO has identified 57 countries with critical shortages of health professionals. And this essentially means that there's a global shortage of 2.4 million doctors, nurses, and midwives in these countries. And these shortages are actually in the places where the disease burden is worst. So for example, in sub-Saharan Africa, which is 24% of the world's burden of disease, has only 3% of the healthcare workforce to address that disease. And even worse yet, possibly more concerning, only 1% of the world's health expenditure with which to address that mismatch. So the global challenge of health professional scale-up exists along a long tradition of altruism and service in the United States. And it dates back as far as Franklin Roosevelt with his Civilian Conservation Corps, which put young men and women to work during the Great Depression. If you flash forward, President George H.W. Bush signed the first National Service Act, which was renewed by President Clinton. And in 2009, the Edward M. Kennedy Serve America Act expanded AmeriCorps and volunteer programs in America. American citizens want to serve. President Kennedy helped nurture this desire. In 1961, he gave a speech at 2 a.m. on the University of Michigan campus. And during that speech, he called that generation to their greater purpose. And he asked Americans for their support, and he asked Americans to serve. He planted the seed for the Peace Corps and a new international program. And today, global health and the campaign for health equity has captured our generation. And if you will, I'd like to be a part of your generation. We know things can and should be different. We want to be able to help serve. I wanted to serve. I spent my years in medical school basically trying to apply for grants and volunteering to spend time in the field and to be able to participate. And I was not alone. In medical school and residency, I met many colleagues in all disciplines, administration, business, education, who all wanted to serve. And I observed as many of them, as well as myself, had to cobble together creative solutions to pay down our education debts and loans while working on small salaries that are so frequent in global health. Some of my colleagues now will actually work nights for 3 months in a row so that they can spend the next 9 months in places like Uganda, Malawi, Mexico, and other places. International service remains prohibitive if you are graduating with the average student debt of $160,000. We need a solution that honors our desire to serve but does not penalize us for doing so. And the goal of the Global Health Service Partnership is to harness the vast energy, your vast energy, and dedication to global health, and especially among all US citizens, especially young citizens, in order to strengthen medical and health education in partner countries. The Global Health Service Partnership, working in conjunction with the Peace Corps and other US health agencies, would be a public-private partnership with US government to recruit, send, and support US doctors, nurses, health administrators, pharmacists, educators, to serve as educators, trainers, and faculty in medical and public health education. Partner countries will work with the Global Health Service Corps or Global Health Service Partnership to determine what their needs are, what their priorities are, and where fellows can have a greatest impact on local health systems. And the work of the Global Health Service Partnership will have a multiplier effect in that training more doctors, nurses, and other health professionals will both rapidly increase the partner country's immediate clinical care capacity, but will also invest in additional health professionals to sustain and build the system for future generations. In addition to investments abroad, the Global Health Service Partnership will build on the legacy of domestic federal programs, and through loan forgiveness to eligible individuals for each year served will support US health professionals and people focused on health, committed to service and health equity. It's worth noting how we arrived at this point. I think, well, some of you know my other identity, which is Senator John Kerry's daughter. And I'm sure that many of you who knew that, or who know that now, think that this was greased to happen. But I have kept this so far from my father. He barely knows I'm working on it. Because its chance for success is if it exists independently, vetted and approved by everyone but him. And we arrived at this point through a combination of persistence, vigilance, and having a good idea that meets a need, perhaps a little luck. Because the truth is, the Global Health Service Partnership may exist in 2 weeks, 3 weeks, because a colleague and I went to a public forum and asked an anonymous question. About 1 year ago, 3 former Peace Corps directors and the current director were participating in a forum at the Kennedy School. And my colleague and I went. And toward the end of the forum, they opened the forum up to questions to the audience, and we waited in line for our turn. Suddenly the spotlight goes on you, and you're kind of sweating, you're a little freaking out, but you still ask your question. We commented on the increased interest in providing technical capacity and training in partner countries, and asked if the Peace Corps would ever expand their program to support doctors, nurses, health professionals to provide this technical capacity, to be technical advisors, and to help scale up care. All 4 directors applauded the idea, and through that forum, and quite candidly, a pretty aggressive push to meet the director after the forum, we were invited to the Peace Corps to discuss and explore the idea. Everything in government is a process, and we are working our way through that process now, but I believe in my heart of hearts we are going to have an announcement very soon. If we don't, we have a backup plan to go private, but I believe in the importance of a federal program that is going to support all of you to do the work that you want to do and make it possible. And I remain hopeful that we are going to see one. This final story is important because this narrative can belong to all of you. You all embrace good ideas. Some may be in different stages where some need to be refined and maybe molded or adjusted a little bit. But importantly, they all exist. And your task is to travel forward with your missions, focused and unwavering. Connect the dots for the public to explain why your ideas are going to implement change. Make sense to people. We live in a country now where people, and Gillian Sorensen talked about my dad's comments last night, but people are not being held accountable, and people are allowed to say these things that are outrageous, that make us, that are fooling people into believing that we have to choose between helping people or ourselves. They don't have to be distinct decisions. So draw on one another's strengths. Come together when your missions are united, or even if they are close enough. You have the opportunity to model what collegiality, partnership, and long-term accompaniment can be. Do not underestimate your voice or power. In a world where over 1 billion people live on close to $1 a day, more Americans are now living in poverty than 50 years ago. The wealth gap is continuing to widen, and millions are still dying of imminently treatable diseases. We must dig in for the long haul. Commit ourselves to effecting change one small step at a time. This work requires patience, but it's absolutely critical, and I am really relieved to know you are all on this collective journey. Thank you.